Hello, my name is Colleen Butler, and I'm a registered nurse with my BSN and a family nurse practitioner student. The topic of my presentation today is interprofessional collaboration for an evidence-based support and education program for healthcare follow-up and prevention of infections and other poor health outcomes among refugees. The purpose of this presentation is to discuss my proposed clinical change and the interprofessional team that is essential to its success. I will be discussing what each member plays a crucial role in implementing my proposed clinical change. I will also be discussing specific strategies that will be used by the interprofessional team in order to collaborate with other healthcare professionals and communication strategies that can be used. Again, my proposed change is called an evidence-based support and education program for healthcare follow-up and prevention of infections and other poor health outcomes among refugees. This relates to the population of refugee patients at a refugee primary care office in Syracuse, New York. The primary care office is affiliated with an urban hospital. Currently in my clinic, there are many barriers and social determinants of health that impact the care that refugee patients get. The goal of my proposed change is to help refugee patients with the information that they are lacking due to language barriers and low health literacy. There are gaps in care for refugees due to a number of factors. Some issues I would like to change are the no-show rate for appointments, the lack of educational information in different languages to provide to the patient's inability to call the office due to language barriers, and several others. There are several key professionals that would need to be a part of this proposed change. I have listed here physicians, nurse practitioners, nurses, pharmacists, social workers, interpreters, RN case managers, and psychiatrists or counselors. Physicians and nurse practitioners are needed because they are the ones treating the patient's medical problems. They are essential to the proposed change because they are able to determine what educational information is lacking for the patients and can help implement the plan. Nurses are needed to assist with education of vaccines, medications, treatments, and more. They are essential to the proposed change because they will be spending the most time with the patients, educating them about things such as vaccines. Pharmacists are needed because oftentimes the patients have no experience taking prescribed medications and often need additional education regarding medication schedules, injectable medications, and diabetes medications. Pharmacists are essential because they can help provide necessary facts about medications to the patients and can develop teaching resources in the patient's language. Social workers play a large part in this proposed clinical change. These patients need additional assistance with navigating the healthcare system. Social workers can assist the patients with their social determinants of health. Oftentimes, these patients have a high no-show rate for their appointments. This can be due to a number of factors, but mostly because the patients do not have transportation. Social workers can assist the patients with setting up Medicaid cabs, teaching them how to use public transportation, or working with the patient's case managers to arrange a ride through them. Social workers can also assist patients with any insurance issues that the patients might not know how to navigate due to their language barrier. Interpreters are a very important part of this clinical change. Without the use of an interpreter, patients are unable to communicate their needs to the staff and unable to ask questions, and the staff is unable to educate the patient about their health or do any teaching with them. We have 3 interpreters currently who work 40 hours a week at the office, who speak a total of 7 languages, which are Kinyarwanda, French, Kirundi, Swahili, Arabic, Dari, and Pashto. When we have patients who don't speak any of those 7 languages, we have iPads that are equipped with a service called Language Line that we use to connect to an interpreter for the visit. RN case managers are an important professional in this proposed clinical change as well. These RNs work with those patients who require more assistance and have the lowest health literacy. The RN case manager role is used to help follow up with patients to determine if they are staying compliant with medications and making their appointments. The case managers work closely with the social workers. Refugee patients have been through many traumatic situations before moving to the United States, and some require additional mental health support. Because of this, we do have one counselor and one psychiatrist in the office that meet with patients weekly or every other week, depending on their needs. This is helpful to those patients suffering from PTSD or other mental health concerns. This here is a visual of each member of the interprofessional team. I don't have specific arrows drawn between each of them because they all actually work together. The team of nurse practitioners, physician's assistants, pharmacists, registered nurses, RN case managers, interpreters, and physicians, social workers, and psychiatrists will work together by using shared decision making. It is important to providers to work with the patients in order to give them all of their treatment options and decide together what is the best course of action for them based off of the information they were educated on and what their preferences and beliefs are. The pharmacist will collaborate with the providers about patient medications. The nurses will address patient needs and educate them as the issues present themselves in real time. The case managers will work with the patients to ensure that appointments are attended and medications are being taken. The case managers will also work with the social worker and the patient to assist with transportation needs, housing concerns, and more. The psychiatrist will consult with the other providers regarding the patient's mental health concerns and medications. The pharmacist would also be a part of this discussion to ensure that there are no medication interactions. The interpreters will work with each of these team members along the way to communicate with the patient. A regular interprofessional team meeting will be held once per week to discuss the processes and workflows, determine what progress is being made with the patients, and discuss improvements that could be made. For specific communication strategies, the development of the clinical concern. In order to establish effective communication from the start, the team will have a daily chat to discuss any immediate concerns regarding the plan. There will also be weekly meetings to discuss bigger concerns or program workflow concerns. Each member of the team will know their clear responsibilities and will share an update during this weekly meeting. For participation, members of the team will each have equal participation, and this will be followed up on during each weekly meeting. The professionals will each have to update the team on their specific role, which will encourage the professional to stay active with the proposed change during the week. For leadership, there is a medical director who is a physician, and this would be the designated leader. Problems will be discussed at the weekly meetings, and if something needs to be addressed with the professional individually, the medical director will schedule a meeting with that professional to discuss it separately. It will be the understanding of every professional that they are to treat each other with respect and provide each other professional with open listening. Any issues or new ideas that arise should be shared with the group in a timely manner so that adjustments can be made. While the leader of the proposed change is the medical director, the nurse practitioner's role is very important as well. Since the nurse practitioners are seeing each patient for appointments, the nurse practitioner is able to provide holistic care to the patient and can advocate for the patient's needs with other members of the interprofessional team. The nurse practitioner is able to coordinate care with specialists for the patients. The nurse practitioner is also in the perfect position to effectively communicate with both leadership and to other members of the interprofessional team. The nurse practitioner can discuss medical ideas or concerns with the medical director, while also delegating tasks to the registered nurses and contacting social workers, case managers, pharmacists, and psychiatrists if needed to communicate that additional care or help is needed. By being in this position, the nurse practitioner can provide quality care to the patient and improve patient outcomes. And these are my references here. Thank you for listening.